and welcome to the Reflection Show with me, Martha Inspice. Today's conversation, should I say, is dedicated to parents. We want to ask, encourage, and let parents pay attention to this conversation. There are some common infections that are, very rampant in children. I didn't say mothers, so I said parents. So if you're a father, you can also sit and listen to this conversation, because you can also take action or also notice these infections in your children. A lot of things are changing, and sometimes our children go to school, they go to play, and they come home with certain infections that probably they didn't have when they went out. But you need to pay attention so that it doesn't become serious to the point that it will not become uncontrollable. I'll be speaking with Dr. Medical Queenly Jejo Lasiji. Hey, I hope I had the name correct. She did not send this conversation for every parent to listen and to know. Let's keep our children healthy so that we can all avoid, having. Anytime I see a child crying when they're in the hospital, I'm like, the child will not be able to even say what is really, affecting them, but they are crying and they are in pain. We can help reduce all of that when we pay attention to our kids. Let's take a break. When we are back, we delve into more. I am Martha Inspice. Stay tuned.
My name is Kezapuma Esayu. When I read, I feel proud. I know I can become anything in the future. Thank you. My name is Mustafa Mufida. Reading helps me understand my lessons better and improves my spelling.
My name is Ahmed Nadra. I am in Basic 6. Reading is the foundation of education. A child who learns to read gains knowledge and confidence.
My name is Al-Hassan Mafwa. Before joining the reading clinic, I was shy to read in class. Now I can read confidently. Thank you.
Welcome back from the break. As the Reflection Show, we want to help our parents understand that their kids are very, very important. We know you go to work, you are trying to look for money to take care of us and all that, but you will not be happy when we eventually don't make it, even after 5 years. Doc, you are welcome to the Reflection Show. Finally, I get to interview you. I think I owe you an interview for a very, very, very long time. So, children. Yeah. Let me say toddlers mostly, from 0 to 5 years old, mostly where the focus should be when we are looking at general infections in children, and then also focusing on respiratory tract infections. So let's look at general. When we talk about infections in children, what is it about generally?
So when we talk about infections in children, there are various organisms that causes the infection. We have viruses, we have bacteria, we have parasites, we even have fungal infections, all causing this infection. So when it comes to children, especially those of school going age or children under 5, there are certain conditions that are very common among them because they get to acquire it when they go to school because of their close contact with their colleagues. So of course, yes, the upper respiratory tract infection, which you already mentioned. Then we have the conjunctivitis, that's a pink eye, or what locally people call Apollo. Okay. Yes. Then we also have diarrheal diseases, that's gastrointestinal infections. Then we can also talk about urinary tract infections. Then otitis media. Otitis media has to do with infection on the ear, but with that particular one, it's when you get the upper respiratory tract infection, there is a possibility you might get an otitis media. So you don't pick that one up, it's from somewhere before you get that particular one. So these are some of the common things that you usually find among children. And let me not forget, chickenpox is also a part of it.
Hey, it's
Yes.
a long time I've heard about chickenpox. Do you still get those in the hospitals?
Oh yeah, when the season is, I mean, it's season now. It comes during a particular season. You get people coming with it, and then most of the time it's acquired because they went to school. I remember when I was a kid myself, I also had chickenpox, and that was, I had it from my sister, and she had it from school. So from school.
They now came to. So, what are some of the things? I'm glad you've mentioned Apollo. Apollo is like when the eyes are red, but it doesn't have to get to that point before, the symptoms should not get to, how do I put it? A serious stage before you take action.
Yes.
What are some of the little and the common symptoms that when they start showing, parents should pay attention?
So that is with Apollo, right? Yes. So with Apollo, usually one of the symptoms that start for parents to see is when the child has a pink eye. The child has a pink eye. The child will be rubbing the eye. Some tear. It's painful for some children. Some children are able to contain it. Yes. So when you see something like that, I mean, it's a viral infection, and most of the time, viral infections tend to resolve on their own without giving any treatment. But we advise that you make sure they wash their hands, and then you would also wash your hand and use some bit of water and try, and then always rinse their eyes. It helps in the infection. If their hands are dirty, because they keep rubbing it, if you don't wash it constantly and they continuously do that, it will become difficult for it to get resolved because they keep reinfecting themselves. So for Apollo, it's just about just getting water and then raising your eyes
regularly.
Yes.
What are some of the other regular infections that you see in children under 5?
Yes. So as I mentioned, the upper respiratory tract infection, which is very common among them, and then diarrhea diseases.
So elaborate on the upper
respiratory.
Yes. What is it about?
So when we talk about upper respiratory tract infection, we are talking about infection, number 1, of the nose, number 2, of the throat. There are different structures in the throat that can get infected. I wouldn't want to go into that details, but we just have to know that infections of your nose, infections of your throat. Commonly, catarrh, which we all know about, common cold, then sore throat. These are some of the things that usually we see in children who have upper respiratory tract infection. So with the upper respiratory tract infection, some of the common symptoms you tend to see is the runny nose, which we all call the catarrh, which I've already mentioned. Then some of them come with cough also. Then the sore throat. Then we have some of them having breathing difficulties, and then also fever is also a part of it. And then children under the age of 5 tend to get this a lot. It's very common among them because when they go to school, they are in close contact with their colleagues, so they always get reinfected every now and then. And then also their immune system is not yet very strong, so they easily contract the virus. Unlike adults may get into close contact with someone, but it may take some time before they get. But with those children under the age of 5, it's something that comes easily to them.
So it means that washing of hands regularly, let me say general good hygiene.
Yes.
But sometimes the kids are very stubborn. You can ask them to wash their hands when they are home and all that. What are some of the other things that parents should monitor them not playing with?
So before I go into that, about the washing of their hands, children are people that learn from routines. So something you do with them frequently, they become used to it. So with the washing of their hands, I mean, we can't just leave it out. Aside every other thing I'll say, washing of the hands is key, because research has even proven that one of the things that help to prevent diseases a lot is when we wash our hands and wash it well. So what parents are supposed to do is they are supposed to be intentional about that training. When even you, the parent, you go out and come in, go to the sink or the tap or whatever it is, and then wash your hand, and make sure your child is watching you. So as you are doing it, you can be singing along and be playing along. They would pick it up. But if it is something that is not done in the house, it will become difficult for the child to learn that. So anytime they come back from school, make it a routine, go and wash your hands. When they play, make it a routine, go and wash your hands. Before they eat, make it a routine, go and wash your hands. Then now coming back to the other things that they have to do. I mean, it's not easy controlling children. That is one thing. It's not easy controlling them. You can't prevent them from playing with other kids. In fact, they need it for their developmental stage. So what I would advise is that if your child is having a cold, if possible, let the child stay at home.
So cold and flu, how do you call it?
They will use them interchangeably.
Okay.
Yes.
Okay.
Cold and flu, use them interchangeably.
Okay.
Some will say, I've got a flu. Some will say, I have a cold. It's just that when you are using flu, people tend to attach different kind of names to it based on the particular virus that is causing it. But they are used interchangeably. Yeah.
So that is for children.
Yeah.
Now, are there treatment options available for these things? Because sometimes children, even when they are growing up, they take a lot of medications. And sometimes some parents are even worried on the kind of medications they even give to their children. Do you just rush a child? These days we see a lot of cough syrups in the market.
Yeah.
So what should be the first point of response?
Okay.
If
a child has a cold, yes.
Yeah.
So with cold, one of the organisms that cause cold most often is viruses. We do have bacteria causing them sometimes, but most of the time it's viruses. And viruses in medical terms, we say they are self-limiting, meaning that they resolve on their own.
Okay.
So you don't give antibiotic when the child has a cold. Maybe it is after an evaluation lab test and then they realize that some parameters are high, then the doctor would prescribe. But you don't rush to give antibiotic because it may be viral. So if it is viral, someone will ask, what medication do we use? We usually treat the symptoms when it comes to cold. So number one, if the child has a fever, when we say a child has a fever, you tell the child, realize the child is warm to touch. What do? Every parent is supposed to have a thermometer in their house.
Okay.
When you realize that your child is very warm, you put the thermometer into the child's armpit and then check the temperature. The normal temperature ranges from 36.5 to 37.4.
Okay.
So if there is anything higher than 37.4, what you do is you first check the child. If the child in any heavy clothing, you loosen it up first, expose the child. Then number two, you tepid sponge the child.
What is that?
So tepid sponging is using lukewarm water to shower the child.
Okay.
I know most people use cold water, but it's not advisable because
Okay. Yes. Some will say like very cold water so that it will.
No, it's not advisable. The child will end up becoming very cold and they start shivering, which is also another problem. Yes. So we use lukewarm water. That is warm, a little bit warm, between warm and cold, that kind of water to shower the child. Then you go ahead and have paracetamol. And every parent must have paracetamol in the house.
But we are told that a lot of paracetamol is not good. So
yes, so you don't use a lot. A lot is when you are overdosing the child. So you have to know the dosage you are supposed to give the child. And of course you would know when you buy the para, they'll put the dosage on it for you. So you will give it to the child and then monitor the child. If the temperature tends to be going 38 degrees or above, you don't sit at home, you go to the hospital immediately. The reason why I'm laying emphasis on that is that it started as a cold. If the temperature is not controlled, we may end up getting more complications. And one of the complications we are scared of is seizures. That is the child convulsing. And it's because the temperature is high and then the brain is having trouble regulating it. So the child starts having seizures. And if the child starts having seizures and the seizure is not controlled well, we can lose the child, unfortunately. Yes. And then also it may affect the brain. It may take time for the brain to recover. So it's very important that the temperature is under check.
You said you are in the ICU.
Yes, I work in intensive care unit.
What is the scariest child situation that's coming? And what do you think the negligence of the parents were?
Well, I wouldn't say negligence per se. I would
ignorance,
maybe
like
ignorance. Yes, the child was referred from another facility to our place, and by the time the child came, the child was already like gone. The child was unconscious, and at my place we work with ventilators a lot. That is the machine that helps you to breathe. So we had to put the child on the machine. So what was the story? It was a child that was playing around, and the child slept. Mother touched the body, realized the child was warm to touch, check the temperature, and as usual, people just start giving medications, antibiotic, paracetamol. I'm not sure on her fever control. Of course, she was not a health person, so she wouldn't know how to control the fever very well. By the time she realized, the child started fitting, having convulsions. So that was when she rushed the child to the hospital. Then they referred the child to my unit. So by the time the child came, because of the several convulsions the child has had, the child was already unconscious. Unfortunately, we couldn't save the child. That child was, I think, a year, 13 months old. That's 1 year, 1 month. Yes.
Wow.
We lost the child. And we did a lot of tests. We checked for malaria, we checked for meningitis. But I believe it could probably be the fact that the fevers were not controlled well. It could just be a common cold. Because malaria, we didn't find anything.
So you said the child was playing, then came to like lie down. So probably was the child overplaying. Like, so I just want us to also look at what are some of the, how do I put it? Should I say some of the plays, like some of the, how they play?
So it's not the playing per se that caused the problem. The child had an infection, maybe, of course, with contact with other children. It could be through anything, not necessarily the playing. It's like you've had the infection. Anytime you have an infection, there's an incubation period. So the infection is there, but you're not showing symptoms yet. After the incubation period passes, the symptoms will start showing. So the child may have had the infection already there, and then that particular organism is now incubating, taking its time for symptoms to show. So you see them playing around all right, but all of a sudden you realize they start spiking.
There is one thing I personally don't like, and I've had issues with people with that, and I wonder why they have issues with me on that. Let me tell you why. You go to a newborn baby's house.
Yes.
And everybody that enters the room, it's holding the baby. I won't hold your baby.
Yes.
But I've had people have issues with me because they feel like me not holding the baby. I said, what's wrong? And what can you tell parents about that? Because personally, no. Let's not even talk about spiritual stuff. Thank God it's not let's look at medical stuff. You see people holding the baby
and kissing
the baby, pegging the baby. Some would even just come out. They have gone to cook whatever. They'll just do their hands like this and carry the baby. Please touch on that for me.
I know a lot of our traditional people don't tend to understand this.
Yes.
I mean, if you're a mother and then you give birth to a baby and you are preventing people from holding the baby, it's like, of course, some kind of thing.
But if I ever give and you come to visit, please don't touch my baby.
That's not the thing.
So how, like, let's educate both the mothers and the well-wishers.
Yeah, but the thing is that you are transferring infections to the baby.
Yes.
This baby is small. Their immune system is
very
not
weak.
growing. And their literally depending on their mother for their immunity through the breast milk that is coming to them. And then you also coming from outside with your own infection, and you have already gained immunity, so you are strong. You are coming with your own organisms, introducing it into this weak child. I mean, mothers have to. So me, for instance, when I give birth, my brother is thankfully a pediatrician in training.
Okay.
Yes. What he advised me to do is that I think for the first 30 days, he was like, if anybody comes and visits, tell the person that the baby is sleeping.
That's all.
And we don't want to disturb the baby.
Yeah.
Don't allow people to hold
Touch
it.
the baby.
My brother is a pastor, but he was talking to me in terms of both medical
Yes,
and then that of the
spiritual,
spiritual aspect. He explained to me the child is a newborn baby.
Some crowd don't even
Now
let people
growing.
even know they've
Yeah.
given birth.
Yes. When you make people touch them continuously like that, you are introducing infections. Some of them we can treat. Some of them we can't treat. And it becomes a problem. So when people come and visit, tell them the baby is sleeping. If the baby is not asleep by then my mom was around. Tell my mom to keep the baby, close the door, and tell them. So if they even hear the baby cry, it's not a problem.
Yes.
The baby was sleeping and it's crying in his sleep.
Yes.
So I think newborn mothers have to pay much attention to that. I mean, it's nice, it's cute when people are holding your baby. It's like people love the baby. It's cute. And it even look more cute to the person holding the baby. But at that stage, they are very fragile. And then we have to protect them.
For me, I also feel that I don't know how to hold a newborn baby. I don't. And sometimes when I'm holding a newborn baby, I'm like, hey, like sometimes, you know, their neck can, and I'm like, hey, I'm not breaking your neck. You know, it's like I'm about to break the baby's hand.
Yeah, I understand you, Era.
I've also seen people rather try to hold the baby some way apart from the infection side. Don't you also think that other medical conditions?
Yeah, you see, there one
Because I
common
feel
thing.
there's a proper way to hold the baby.
Oh yes, there is a proper way to hold the baby. Because I think you make the head lie here. In fact, the neck lie in your here. I want to use a medical term, but it's okay. Here, the space here, make it the neck of the baby, because they don't have neck control.
Yes.
At that moment, so that you don't end up causing any problem to the baby. So you hold it that way. If you can't hold the baby, leave the baby to the mother. Because as they go for antenatal classes, and then even after giving birth, the midwives do due diligence to teach you how to hold the baby. So if someone cannot hold the baby, it's either you teach the person or you don't let people even hold the baby at all. In fact, just let the baby rest.
Yes.
When the baby is growing a little, then you can start giving the baby out. Yeah.
I think for Christians, maybe it may be a bit better because some people can even wait up to even 6 months before they name the baby or they outdoor the baby. But usually even up to 3 months. But maybe other religions like we are here, Muslims, by the 7th day, 8th day, you have to outdoor the baby. What can they also do to reduce or prevent infections in their newborns?
As for when we want to look a little bit culturally, there are a lot of things that the traditional people tend to do for the babies, which cause a lot of problem. So number one, we've already spoken about the holding of the baby. Number two, when it comes to, the navel of the baby, by then the umbilical cord has been cut and then it is still exposed. We are waiting for the remnants to fall out. Some people tend to apply some kind of local medications or herbal medications around it, and we've seen a lot in the hospital coming with very bad conditions because it gets infected. Yes, and when it gets infected, it can result in something we call sepsis. That is bacteria in the blood.
They cut that at home?
So some people that maybe they give birth at home.
Okay.
They may do the cutting at home. But also, they give birth in the hospital. The cutting is done in the hospital. But there are still remnants that is supposed to be taken care of.
Remnants is what? They're still sore.
Okay, so when you look at the umbilical cord,
yes.
after they cut it, you realize there is a part left that they've used something like a peg. I mean, it's a cord clamp.
Okay.
They've used it to hold it, and then usually when they are bathing the baby, the mothers dress it with spirits. Yes,
Okay.
they teach them in the hospital, and so that's what I mean by the remnants. That's the remaining part that is left, which will fall off on its own.
Okay.
Yes, but usually what the local people do is they have this herbal medications or concoction, I don't know what it is, and they've been applying it on it. It becomes infected, and by the time the child gets to the hospital, the child is bad, and that kind of infection kills neonatal sepsis. It kills. It's a bacterial infection. That is bacterial infection in your blood, so your whole system is being affected. And you could see it like just bacterial infection, but it's not just bacterial infection. At the end of the day, you may end up getting a multi-organ failure because of that particular condition. So that's one thing most people do, especially that I like to use the term the traditional people. That's what they do, apply something, and I mean, it's something that we have to pay attention to. Then number 2, jaundice, that's yellowing of the eye, which we commonly see, or the yellowing of the skin. What we usually see in most of our local people is that because they have to name their child 7 days or after 8 days, when they see the yellowing, instead of bringing the child to the hospital, they don't bring the child. They keep the child and bring the child after the 7th or 8th day. And by the time the child comes,
because they don't want to.
Exactly. By the time the child comes, the child is already bad. And this jaundice,
So that happens sometimes immediately after birth.
So immediately after birth, jaundice, for instance, has a lot of causes. Number 1, infection can cause jaundice. Number 2, the way the baby was delivered. Maybe when the baby was delivered and then the delivery was a bit stressful for both baby and the mother, there can be some bleeding, not so much bleeding, but it can also lead to jaundice. Then sometimes it just happens. We have physiological jaundice, pathological jaundice. Like it just happened. There is no cause. It just happens, and you usually start noticing it on the 3rd day when the baby is day 3. Then you usually start seeing it.
Okay.
But the thing is that we don't know whether this jaundice is just a normal jaundice or it is the bad one. So we usually advise parents that
Earlier you come.
yes, come and let's test. There are tests we do. We'll chart it on the chart and see whether you fall in this range or outside this range. But our local people tend to keep the children after 7 days. By the time they come, it's already worse off. And then you know what happened? Because the jaundice is we call something bilirubin that the liver is supposed to metabolize. But a newborn baby, their liver is not matured yet, so that is not able to happen. And because that chemical is still in the system, and then the liver is not able to do that work well, when we don't act, we will put the child under some kind of light we call phototherapy, and that light is supposed to help metabolize that particular chemical. So if you don't bring the child early and it keeps accumulating, it enters into the brain, and you have damaged the child's life for life. I've used 2 words at the life for life. Yes.
Let's look at bathing the child. I see it's also one way that infections can be transferred, because sometimes people want to use different kinds of things. Apart from even the traditional people, we the modern people, especially if you're having your first child, you want to buy all the antiseptic, all the new baby bath. Let's look at both sides. Can these things also cause infections to the child? I'm glad you mentioned chicken pox, which means there could also be other skin conditions. So let's look at bathing the baby and
so bathing the baby, we are also particular about what you use. So we usually advise that you go for things that are gentle on the skin of the baby. So of course I don't want to mention the brand. The brands are there. You can use them. I mean, you don't have to go so sophisticated. It's not necessary. Just when you go to the hospital, they'll give you a list. just use those things. Don't go and now you've heard of this and that and that. It's not necessary. Just go with the list the hospital has given you. Use
But
those
some
things
also
and
say
should be
that
fine.
newborns are not supposed to be like bath every day.
I think, well, medically we have not said anything like that.
Okay.
Maybe traditionally they have said it, but
What
think
we
it's
usually
okay
see
to
is
become a
bathing morning and evening is that's what
it's okay. It's okay to bath them, because remember, as you are breastfeeding, the breast milk is pouring on them, and then milk is a good medium for bacterial growth.
okay.
Yes.
Wow.
So it's good you bath the baby. At least you could take that off from the baby. For the child not to get any skin infection, because skin infection is also one common thing among children, especially babies.
Apart from chicken pox, what are the other common skin infections?
They are medically. I'll try and then mention some of them.
Okay.
So we have some skin infection caused by Staphylococcus. That's a bacteria
Okay.
that causes Staphylococcus. I don't know, in local terms they call it tomanthus.
Is it the one the little rashes that
Yes, and it looks a bit like reddish.
Okay.
Yes, on the skin of the children. And of course, we have the heat rashes also. We have, see, the dermatological skin, they are a lot.
Okay.
They are a lot. That happens to the children. Now, most of the time, infection is one of the causes. Some of them bacteria, some of them viruses, some are fungal infections. So there are quite a number of them. But the chicken pox is what
It's quite
most
very
people know.
common.
Yeah.
Because chicken pox, like sometimes they'll say you use what's the name? Chalk, you mix chalk with like chicken pox. It has a lot of medications actually.
I think it's because of the calamine lotion that is being used, and then when you apply it on the skin of the children, it looks white. That's why people think that you have to use chalk.
Okay.
No.
All right, parents. I remember one time in one of my interviews, I was like, mother. Someone said, Martha, say parents. And I was saying, I have changed. So parents, fathers and mothers, you have listened, and I believe we'll do better. Let's take a break. When we are back, we delve into more.
Yeah.
My name is Kezapuma Esaibu. When I read, I feel proud. I know I can become anything in the future. Thank you. My name is Mustafa Mofida. Reading helps me understand my lessons better and improves my spelling.
My name is Ahmed Nadra. I am in Basic 6. Reading is the foundation of education. A child who learns to read gains knowledge and confidence.
My name is Alhassan Mafwa. Before joining the reading clinic, I was shy to read in class. Now I can read confidently. Thank you.
Welcome back. Still the reflection show with me, Martha Inspires. We are encouraging parents to watch this episode in. If you know any parent out there, or in fact to be parents, make sure that you send them the link of this episode, because they need to prepare. Or anyone about to get married, some of you have been just busy preparing for your weddings and stuff. Please prepare for your babies. The unborn babies, you've already giving them names. These are some of the episodes you need to, watch to prepare yourself. Let's look at diarrhea. Even an adult's cry, sometimes it can be so uncomfortable. Children, what are the causes? What are the symptoms, and how can we manage it?
Okay. So when we talk about diarrhea, is a child passing loose or watery stools, and that is when the child passes like at least 3 or more in a day, then you should know the child has diarrhea. That is more than the normal of the child. You should know the child has diarrhea, especially when it's loose and then it's watery. Diarrhea, though mild it may seem, it's one important aspect in the medical field that we don't joke with. The reason is, if it is left not being managed, I don't want to use the word treated, so that maybe we ask me, so what medicine should we use? No. So if it is left not managed, can complicate into serious things. And if I mean serious, death is serious.
Wow.
Children can die. And then I have experienced that during my training when I was in the pediatrics department. It was sad. I think one child that I can't get off my memory up till now, and it's been years ago. They were twins. I mean, both of them were running diarrhea. Wow. Yeah, and then they brought them in the early hours of the day. That day I did a 9 duty show, early hours of the day, they brought them in. By the time they brought the twin in, oh God, the child was very weak and was almost gone. We couldn't save the child. We lost that twin. So quickly we asked for the second twin. They brought the second twin. Also had already started the diarrhea, but hadn't gotten to the stage of that of a twin sister.
Wow.
So we were able to manage that. Anyway, so when a child is having diarrhea, one thing a parent is supposed to do, let me talk about the causes first, then I'll get into the management. The causes, of course, is also, most of the time is viral infection. And then we also have the bacteria also causing that one too. So children picking things from the floor and then eating causes diarrhea, eating contaminated food, all those kind of things causing diarrhea. So you see, the whole thing about hand washing, if you want to talk about everything in medicine, you realize that hand washing is just a thing. And hygiene is just a thing. Yeah. That's why parents have to be intentional about teaching their children how to wash their hands properly. That's one of the common causes of it. Now, when the diarrhea happens, what do you do? It has happened. What do you do? Every parent is supposed to have at least ORS in their home. I mentioned paracetamol. I mentioned ORS too. So ORS, anytime the child passes the loose stool, you give like 100 mils to the child to drink, 100 or 200 mils to the child to drink. Yes. So not necessarily about the stopping. The stopping will stop on its own. But what you are doing is you are replacing fluid and then electrolytes, which are getting lost as the child is pooping. And that is what causes the problem. The fluid that is getting lost. Because the child enters into something we call shock. When the child loses a lot of fluid. And then we can also have electrolyte imbalances when electrolytes are coming out. So as you are given the ORS, not necessarily to stop the diarrhea per se, but it is to replace the fluid and then the electrolyte that are being lost. So anytime the child goes, you will give. Anytime the child goes, you give. Now aside the ORS, now let me talk about medicine. There's another medication we add to it, zinc tablet. At least the zinc can help in stopping the diarrhea, but not completely. Okay. But it is also replacing a particular nutrient which is also coming out. That is why you have to give it to the child too. We give that one once a day. Then you give the ORS anytime the child vomits or the child loses anyway, as in the child passes the stool. And then we advise that do the ORS for 24 hours. After 24 hours, if the child is still pooing or if the diarrhea is still occurring, send the child to the hospital. Okay. Yes. So that the health workers will take it from there. Yeah.
So there is this common thing I keep hearing, that the reason why parents may not want to frequent the hospital is that almost every time you want to admit the child. And then the parents also have maybe a job to do. They have something to do, and in the ward where children are, sleeping, there's no place for mothers or caregivers to stay. So it's kind of stressful. Sometimes you can also sit by your child throughout and all that.
So
why are you always quick to admit a child?
I'm
just asking you the questions they have been asking.
What most people don't know is that we don't like admission. Okay. You know why? You are giving me a lot of work.
How?
Because when I admit the child, I'm responsible for that child till the child is discharged. Okay. So when I come to work, you have to work on the child. There is a lot of things you'll be doing. Remember, when you are giving medications through the vein, you have to pass an IV line, which can get dislodged. And then when it gets dislodged, you have to pass a new one. It's not easy getting those IV lines. It's a lot of work. Then you realize your waist is paining you. And you have to keep monitoring the child, because once the child is under your care, you are responsible for that child. If anything should happen to that child, you'll be held responsible. You have to answer. Because medically, we go for mortality meetings every now and then for every mortalities we get. So you need to answer questions on what happened. And then you lost the child. So people just have to know that we don't like admission. That they have to know. But the reason why we admit is because it is necessary. We have to save the child. Whatever is happening to the child, you can't treat the child at home. You need some kind of support, and that kind of support can only be done in the hospital. We understand it's very stressful. You have to leave your job, come and sit with the child. You have to be running errands and then all that.
And our hospitals do not also have, let me say, if there was like a lounge where you could even sit whilst these days people can even work, you know, so maybe you just come and check on your child for like 10, 15 minutes. You go back, you are still able to work and do your virtual meetings, but it's stressful.
Yes, as for the stressful, it is. And I think maybe our hospitals have to consider that. And it's create a parlor, a lounge or something that caregivers can at least get a place and then rest.
Yes.
We don't have that. That is very true. But then we can take it up. If the hospitals didn't take it up, maybe some private industries can partner with the hospital, do that. They can be cashing money out of it. You don't really have to make it expensive. Just
something
affordable for people to at least rest in. Taking care of a child or any sick person is stressful. It's not a joke. It's stressful. There was an instant, I think, somewhere, about 6 months ago, I went to see one particular case. The relative had to be running around. By the time she was done in the last errand, she collapsed. Yes.
The relative taking care of the patient became a patient.
We see it most of the time.
What do they run around for? Is it usually the medications having to get? And okay, I don't want to mention any hospital. There's a big hospital, very big hospital in Tamale. I don't like where their payment points are. It's very far from each other. So if the person is in such a hospital, the person could faint. Because sometimes you are practically supposed to, but I think now that there's a system whereby you can have everything on your name, on your card, and later on you go pay. But I think that the points are quite a distance. And because there are also a lot of patients, there's no way where there could be, let's say, a virtual order, maybe bed one. You know, the doctor has put that this bed needs para, this. And there's a way that quickly gets to my bed. It's like someone has to now go, even going to the lab. Sometimes you as the sick patient have to walk to the lab. It's quite stressful.
Yes, it's stressful. That is true.
So if you don't have somebody like taking care of you at the hospital, most times you just probably, except you just find a very nice medical person who would help you maybe an hour after their shift is over or during their shift, or a patient relative who also want to help you if you don't know them.
Yeah, maybe sometimes some people can step in, but a medical person may not want you. The reason is because of some tags that are being attached to you when you are doing that. Why? People tend to blame people a lot for the little thing. People can blame you. You are cheating me of my money. You are, because I'm in my vulnerable state, you are trying to take advantage of me. There are a lot of accusations that come from different aspects. So as medical people, we are also very careful. That is part of the reasons why when the medications are prescribed, the labs are requested for. They still ask a relative to handle that. Go to the payment point and go and pay, so that you don't accuse anybody of any kind of issue. It's just the way human beings behave. But I think it can be made better, where it can be easily accessible. You don't have to be running around and be doing all that, because trust me, it's stressful.
It's very
stressful.
It's actually very, very stressful. And there's another one that says that, well, this may not just be for children, that says that when someone comes to the hospital and they are not fainting, you people don't have some sense of urgency to attend to the person.
So, when you come to the hospital have different sessions. It depends on where you are. And when you are going to
session?
Emergency, of course. Just like the day. Emergency. The wards are busy, but I mean the entry point emergency. You either go to the polyclinic or you are coming to the emergency. When you are going to the polyclinic, it means you are stable. Okay. Meaning that whatever is happening to you will not kill you right now. Maybe later. But now, it's not something that would be killing you. So, of course, you would go and then you may spend a lot of time, which is not supposed to be. But because of the patient-doctor ratio, you may not get the care immediately. It's not like they really do not want to care about you.
That's
but
why
sometimes
I think
the
some
numbers.
of us will need to go and do thorough medical checkup.
Yes, it's important because when you do the medical checkup and there is anything, they can pick it up quickly than when you come in a bad state. Because by the time you come in a bad state, if it is an emergency, you'll be attended to. But if you are the polyclinic, they will attend to you. But because of the queue, it may take some time for them to get to your turn. And it is not like it's because you are not fainting. We usually give priority to emergencies first. Life-threatening conditions, like something that within the next few minutes, if I don't do something, you go or you become complicated. Yes, but if you're a stable person, it's not like you are being ignored. It's just that we are begging you to allow to give priority to someone that is dying.
Emergency, what are some of the most emergency cases that comes to the hospital?
Is it adults or children?
Both. But both.
For emergency, there are a lot with
Accidents?
Children. Accidentally, oh good, normally the accident.
So is that why they say that when you come and it's accident, whether you like it or not, and they say small pain on your leg, they'll cut your leg?
It's not true. Why would they cut your leg?
When you just have a little fracture on your leg, something they can do, and so they'll just want to cut your leg.
No, they won't cut it.
Okay,
they won't cut.
So Tamale people, please, that is not true.
They won't cut your leg.
So accidents.
So we have accident. We have had hypertensive crisis coming in a lot of late. People are getting hypertension a lot. The young, the old. So they come in various forms. Some come with heart attacks and other things. We get all that in the hospital. Yes. Then the chronic conditions that people have kept in the house for very long and they become very bad. Like you have a liver condition, chronic liver disease, you are doing local treatment. Now that you can't breathe and then you've become swollen all over, you're not rushing to the hospital. They also come. When you come to the children's side, diarrhea. Yes. When the diarrhea become worse, when they are entering into shock, they rush them. The respiratory tract infection, it can be a pneumonia, difficulty in breathing, they rush them. I forgot to mention this when I was talking about the upper respiratory tract infection. If the child is having difficulty in breathing, don't sit in the house, send the child to the hospital, because it's one of the things that can take the child's life easily. So diarrhea diseases, upper respiratory tract or even lower respiratory tract infections, they bring them to the hospital. Basically, difficulty in breathing, they come as emergencies to the hospital. And there are other things, congenital conditions, like they may be having a heart failure, they also come. Then those with malnutrition also come as emergencies to the hospital.
So just to touch on it, we don't have a lot of time now, but you mentioned malnutrition. Why should we focus? Because infections and maybe health issues with children also comes with nutrition. I know that sometimes people think that you have to eat a lot, but just what are some of the basic things that kids can eat?
It's not about eating a lot, it's about eating quality food, balanced diet, which is very important, and be intentional about feeding the child. Children are a different kind of human being. You literally have to force them to do some things or help them. Let me use the word help instead of force. Help them to do something. So as a parent, you have to be intentional about what they eat. What do they eat? Always make sure that the child gets fruits at least once every day. Drink water, eat something of a carbohydrate diet, add some protein to it. for the child to eat every day. And for children, they can eat many times a day. Anything from 3, 4, 5 is okay for the child. Just be intentional about it, and you don't have to force everything down their throat in one sitting. Some children don't like to eat, so you would have to feed them frequently, meaning that you have to let them eat in beds. So when they eat a little, maybe 2 hours time later, you have to feed them. And that is intentional parenting. You have to be intentional about it, so that the child doesn't become malnourished. Because malnutrition is also a big topic on its own.
Yes. Your final words to parents.
So my final words to parents: it's not easy raising a child. It's very, very difficult. I got to know this myself when I also gave birth and I had to raise a child. We need to be intentional about our children every now and then. Intentional about their health, intentional about their feeding, intentional about everything they do. Even if they are playing, you need to particularly pay attention to what they are playing with before they push down anything into their throat, and then that's the end of them. So intentionality is the key word I want to give to to parents now. If you find anything that you are not comfortable with or you are not sure, ask. Don't assume, ask. Saying to you, go to the hospital, let them tell there is nothing wrong, bring the child back. It's better that way than sitting and I don't want to go, I don't want it to appear like I'm some way. You are not some way when it comes to your child.
If you are somewhere, what's wrong is your child.
Yes, just be intentional about it. Allow people to teach you. I know there are people that tend to talk, you ask for you, when there's a little thing about your child, you are some way. Allow them to say there's some way. It's better that you would keep that and then preventing them from calling you some way, and then you will end up having complications, which maybe can never be treated. So, my last word to parents is, be an intentional parent.
Be an intention. I think I like that. Do you know why sometimes you struggle to be intentional parents? So you grow up, hey, you have age, you are growing. Charlie, just get someone and marry. You marry, what next? Have children. There's no planning.
Yeah.
Because it looks like I'm old, I have to marry, I have to start having kids. But are you intentional about bringing another human being to this world? And I'm not a parent, but sometimes I realize that once you have a child, your schedules actually even depends on your child.
Yes.
Where you want to go, what you want to do. You can be at the office and you get a call that your child is sick at school. You have to leave and go pick up the child. If you can't go, you have to look for someone to go pick them up.
Exactly.
It's not easy. So parents, just be intentional about taking care of your child, because they are our future leaders, and our future leaders need to grow strong and healthy. Dr. Queenie, thank you so much. Dr. Medic, hey, please, she said something that when you go and see a doctor, ask whether it's a medical doctor, a pharmacy doctor, or a lab doctor, so that if there's an issue and they ask you, you know which doctor actually attended to you. So anytime I go to the hospital, I say, please, you are a doctor. What kind of doctor? Before a book doctor goes to read a book. And parents as well, my last words to you as well is to stop putting symptoms in AI. Sometimes it can get out of hand. It may even exaggerate what your child is going through. So let's try as much as possible. Thank you so much for coming. We really appreciate your time with us on the Reflection Show. And don't forget, as usual, we still are appealing for clothes, for shoes, for anything, learning materials for our kids at the Reading Clinic. We are appealing for anything you can to support our Reading Clinic. Our kids are ready. Now we are learning robotics. We are learning STEM, we are learning IT, we are learning coding. Charlie, these days the kids are learning a lot. So if you have some laptops, some robotic items, whatever you have that you can give to our kids to learn, will be great to receive the support, the learning of our children here. We are in Tamale. You can call us on 054-9578-512. The Martha Inspires Foundation. We always need your support. Just type Martha Inspires Foundation on your browser. It will take you to our website or on Facebook, and you see all the amazing work that we are doing with all your donations and your support. Thank you you so much for watching. I am Martha Inspires. Do have a good night. Hello there, and welcome to Thoughts from Martha Inspires. Today I want to talk to you about what I have captioned, You Will Be Fine. Whatever you are going through, are you anxious? Are you depressed? Whatever situation that you are thinking, will this issue ever pass? I want to assure you, I don't have all the answers today, but you will be fine. God will heal you. He will restore you, and He would honor you. Whatever your heart is feeling, that pain, that anger, that distress, I don't know what the world is saying to you, what the situation seems like, but all I know is that you will be fine. God will heal that heart of pain. Is your heart broken? Are you depressed out of family issues or educational issues or even financial issues? You don't know where the next meal will come. This season will pass. This season of uncertainty, this season that you don't even know how to maneuver around, it will come to pass, and you will embrace a season of healing, a season of restoration, and a season of honor. I know that one day you will get back to this video and you will be happy that these few words of mine inspired you. Thank you for watching this episode on Thoughts from Martha Inspires. See you next time.